Your body is a complex machine, a marvel of biological engineering. Many tiny parts work together in harmony to keep you alive and well. One of these crucial parts is your thyroid gland, a small but mighty organ. It sits quietly in your neck, often unnoticed. Shaped like a butterfly, it is small, yet its influence is vast. Its impact on your well-being is enormous, affecting various aspects of your health. Think of it as a master conductor, orchestrating your body's most vital functions. It directs many of your body's essential processes, ensuring everything runs smoothly. The thyroid gland produces hormones, which are chemical messengers. These hormones travel throughout your bloodstream, reaching every part of your body. They tell your cells what to do, guiding their actions and responses. They control how fast your body uses energy, a process known as your metabolic rate. This metabolic rate is crucial for maintaining your energy levels and overall health. It affects your heart rate, ensuring your heart beats at a healthy pace. It influences your body temperature, keeping it within a normal range. It even plays a role in your mood, affecting how you feel emotionally. Your brain development also relies on it, especially during early stages of life. So does the health of your skin, hair, and nails, which are indicators of your overall well-being. Many people overlook their thyroid, not realizing its importance. They do not think about it until something goes wrong. Not until something goes wrong, causing symptoms that can affect daily life. Understanding your thyroid is key to maintaining your health and well-being. Let us begin this important journey to learn more about this unsung hero of your body. To understand anti-TPO, we first need to meet TPO. TPO stands for thyroid peroxidase. This is an enzyme. Enzymes are proteins that speed up chemical reactions. TPO has a very specific job. It works exclusively within your thyroid gland. It is essential for making thyroid hormones. Think of it as a skilled artisan. It carefully crafts the hormones you need. Thyroid peroxidase plays a crucial role. It is involved in two key steps. First, it helps add iodine to a protein. This protein is called thyroglobulin. Iodine is a mineral you get from food. It is absolutely essential for thyroid hormone production. TPO makes sure iodine attaches correctly. The second critical step involves coupling. TPO helps join together iodinated tyrosine molecules. This creates the final product. These hormones then go out into your body. They regulate your metabolism. Now let's talk about anti-TPO. The anti-prefix is important here. It means against. So, anti-TPO means against thyroid peroxidase. Antibodies are proteins made by your immune system. Your immune system is your body's defense force. It usually protects you from invaders. Invaders like bacteria and viruses. Antibodies are like targeted missiles. They identify and neutralize threats. However, sometimes the immune system makes a mistake. It might wrongly identify a part of your own body as foreign. Anti-TPO antibodies are a type of autoantibody. They specifically target the thyroid peroxidase enzyme. This is a case of friendly fire. Anti-TPO antibodies are not good. They are a sign of an internal conflict. Your immune system is attacking your thyroid gland. Why would your body do this? Why attack its own helpful enzyme? The exact reasons are complex. Scientists are still learning. However, we know it involves autoimmunity. Autoimmunity is when the immune system loses tolerance. It fails to distinguish self from non-self. It starts attacking healthy cells and tissues. In this case, the thyroid gland is the target. Specifically, the TPO enzyme is singled out. Several factors likely contribute to this misguided attack. Genetics play a role. Some people are more predisposed to autoimmune conditions. Environmental triggers are also suspected. These could be infections, or exposure to certain chemicals or toxins. Even stress might be a factor. Think of your immune system as highly trained, but sometimes certain events can confuse it. Section 5. Seeking answers. Why your doctor might order an anti-TPO test. Your doctor might recommend an anti-TPO test for several reasons. It is not a routine test for everyone. It is usually ordered when there is suspicion. Suspicion of a thyroid problem, especially an autoimmune one. Perhaps you have symptoms of thyroid dysfunction. These symptoms can be vague. They can also overlap with other conditions. This makes diagnosis tricky. The anti-TPO test provides a crucial clue. Common symptoms might include fatigue, unexplained weight gain or difficulty losing weight. You might feel cold when others do not. Constipation can be an issue. Dry skin and hair loss are also common. Some people experience muscle aches and weakness. Section 6. Decoding the numbers. Understanding your anti-TPO test results. When you get your anti-TPO test results, you will see a number. This number will be compared to a reference range. The reference range is provided by the laboratory. It indicates what is considered normal. If your anti-TPO level is below the upper limit of this range, it is usually considered negative. This means significant levels of these antibodies were not detected, which is generally good news for autoimmune thyroid disease. However, a positive result means your anti-TPO levels are elevated. They are above the laboratory's reference range. This indicates the presence of these autoantibodies and suggests an autoimmune process targeting your thyroid. The degree of elevation can vary greatly. Some people might have slightly elevated levels while others might have very high levels. It is important not to panic. Section 7. High anti-TPO, a major clue for Hashimoto's thyroiditis. This section delves into the significance of anti-TPO antibodies in diagnosing Hashimoto's thyroiditis, a prevalent autoimmune disorder. Elevated anti-TPO antibodies are most commonly associated with one condition, Hashimoto's thyroiditis. These antibodies target thyroid peroxidase, an enzyme crucial for thyroid hormone production. Hashimoto's is an autoimmune disorder and the most common cause of hypothyroidism in areas with sufficient iodine. It occurs when the immune system mistakenly attacks the thyroid gland. In Hashimoto's, the immune system gradually attacks and destroys thyroid tissue, impairing the thyroid's ability to produce hormones. This ongoing damage can lead to chronic inflammation and scarring of the thyroid gland. Over time, this can lead to an underactive thyroid, known as hypothyroidism. Symptoms of hypothyroidism can include fatigue, weight gain, and depression. The presence of anti-TPO antibodies is a hallmark of Hashimoto's. These antibodies can be detected through a simple blood test. In fact, about 90% of people with Hashimoto's have these antibodies. This high prevalence makes anti-TPO a critical marker for diagnosis, so a positive anti-TPO test strongly suggests this diagnosis, especially if you also have symptoms of hypothyroidism or if your TSH level is elevated. Early detection can help manage the condition more effectively. Hashimoto's often develops slowly, and it can take years for significant thyroid damage to occur. Regular monitoring of thyroid function is essential for those at risk. The antibodies might be present long before thyroid hormone levels become abnormal. This means that individuals can have anti-TPO antibodies for years without showing symptoms. It is important to know that not everyone with anti-TPO antibodies will develop hypothyroidism. However, understanding your antibody status can help you and your healthcare provider make informed decisions about your thyroid health. Section 8. Beyond Hashimoto's, other meanings of elevated anti-TPO. While Hashimoto's is the prime suspect, high anti-TPO levels can appear elsewhere. They are not exclusively tied to this one condition. For instance, a smaller percentage of people with Graves' disease may also have anti-TPO antibodies. Graves' disease is another autoimmune thyroid condition, but it typically causes hyperthyroidism and overactive thyroid. The main antibodies in Graves' disease are different. They are thyroid-stimulating immunoglobulins, TSI. However, anti-TPO can sometimes coexist. Elevated anti-TPO antibodies can also be found in some individuals without overt thyroid disease. A small percentage of the general population may have these antibodies, and their thyroid function tests, TSH, T4, T3, might be completely normal. They may have no symptoms. This is more common in women and as people get older. The presence of these antibodies, even with normal thyroid function, does indicate an underlying autoimmune process. It signals a predisposition. Section 9. Nourishing your shield, a path to thyroid harmony and vitality. Discovering you have elevated anti-TPO antibodies can be unsettling, but it is also an opportunity. It's a wake-up call to pay closer attention to your thyroid health and take necessary actions. It is a chance to take proactive steps towards better thyroid health and overall well-being. Embracing this journey can lead to a more balanced and vibrant life. The first step is always to consult your doctor. They are your best resource for understanding your condition and planning the next steps. They can provide a proper diagnosis and discuss treatment options if needed. This might include medication, lifestyle changes, or other interventions. If hypothyroidism is present, thyroid hormone replacement therapy is often very effective and manages the symptoms well. Regular monitoring and adjustments ensure optimal results. Beyond medication, lifestyle factors can play a significant role. Incorporating regular exercise, a balanced diet, and stress management techniques can make a big difference. Many people find that dietary changes can help. Eating a variety of nutrient-rich foods supports overall health and can positively impact thyroid function. Reducing inflammatory foods might be beneficial. This includes cutting back on processed foods, sugar, and foods that you may be sensitive to. Processed foods, sugar, and certain food sensitivities can fuel inflammation. Being mindful of what you eat can help manage symptoms. Some find that a gluten-free diet helps reduce antibody levels or improve symptoms. While this is not universal, it is worth exploring with guidance from a healthcare professional. This is not universal, but it is worth exploring with guidance. Consulting a dietitian can provide personalized advice tailored to your needs. Focus on whole, nutrient-dense foods. These foods provide the vitamins and minerals essential for thyroid health. Foods rich in selenium, zinc, and vitamin D are important for thyroid health. Including these in your diet can support your thyroid function. Managing stress is also crucial. Chronic stress can negatively impact your immune system and exacerbate autoimmune conditions. Chronic stress can wreak havoc on your immune system and exacerbate autoimmune conditions. Finding effective ways to manage stress is essential. Find stress reduction techniques that work for you. Whether it's through hobbies, exercise, or mindfulness practices, reducing stress can significantly improve your quality of life.